Hi, my name is Naomi Shipley, and for my Capstone research project in emerging issues in drug abuse, I selected the topic of autism and addiction. The reason why I selected this topic is because in the past I have worked with children who were either on the spectrum or had sensory processing disorder, which symptoms mimic or are similar to those of autism spectrum disorder. And while I was working with those children, I observed what I perceived to be video game addiction, or that the children were more prone to wanting to use electronics more so than neurotypical children. So from there, for this opportunity to do some research, I wanted to see if there were parallels in individuals with autism spectrum disorder and whether or not they were more prone to drug addiction than neurotypical individuals. Autism and addiction aren't words that are considered synonymous because historically their comorbidity has not been commonplace. Individuals with autism spectrum disorder historically were not considered at risk for substance abuse, and screening for co-occurring ASD and substance abuse disorder was not and is still currently not generally routine during clinical assessment. However, the research indicates that 19 to 30% of patients who have autism spectrum disorder also have substance use related problems. And with nearly 1% of the world's population having autism spectrum disorder and 1 in 68 children being diagnosed, there is currently a large population of individuals that are at risk and whose needs are not currently being addressed. Rothwell suggests that most research indicates how little is known about successful interventions for individuals with autism spectrum disorder and co-occurring substance abuse disorder. Understanding the link between autism and addiction is no easy feat. Research indicates that the high rates of substance use-related problems are attributed to the comorbidity of autism spectrum disorder and attention deficit hyperactivity disorder, ADHD. Additionally, the evidence indicates that there is shared familial etiology of ADHD and substance abuse disorder. Genes and molecules that exist in individuals with autism spectrum disorder that have been studied emerged as potential mediators to addiction-related behavior. These include genes known to cause Rett syndrome and Fragile X syndrome. One of the most apparent and defining features of both addiction and autism spectrum disorder are compulsive behaviors, although there's different terminology. In addiction, they're considered habitual, and in autism spectrum disorder, they're considered stereotype repetitive behavioral patterns such as hand flapping. One thing for certain is that traditional approaches for intervention and treatment of substance abuse disorder in patients who have autism spectrum disorder is that they're not going to be effective, and in fact they can prove detrimental. Autism spectrum disorder is characterized by dissimilarities in cognitive abilities and social aloofness. So there are additional barriers to treatment that have not been addressed yet and will pose problems for individuals with autism seeking treatment for substance abuse disorder. The current treatment options often promote group therapies, but individuals with autism who are forced into this type of treatment, it may induce anxiety and anger and cause them to remove themselves altogether. It seems relatively straightforward, but there exists a very pressing need for future research into assessing and treating individuals with autism spectrum disorder for substance abuse disorder. Thank you for your time.